So let's briefly discuss the limitations to reversal designs. There are three specific limitations. One is ethical and safety concerns regarding reversal on a dangerous behavior. So if you think about an AB design and the behavior that the student engages in is unsafe, maybe it's some sort of self-injurious behavior, then there is concern about returning back to baseline. So for example, I had a student who would pull his teeth out when he was upset, and we got him a helmet that had a chin strap that stopped him from being able to reach into his mouth and pull his teeth out. Now, had we decided that we wanted to conduct a reversal design to ensure that there was a functional relation between the wearing of the helmet and the reduction of, it would have been unethical for us to do so, for us to return back to that dangerous behavior and allow him to pull out another tooth by removing the helmet. So that's something that we wouldn't have done, and that's an example. And there are times when researchers want to investigate these types of dangerous behaviors, but a reversal design is likely not the best type of research design to do with those types of behaviors. Another limitation to reversal designs is that sometimes the folks that are involved in the research aren't going to agree to a reversal design. So you might be working with a teacher or a parent on a child-specific behavior, and you introduce the intervention, and they are so pleased with the intervention, and they are not comfortable with you having the child return his or her behaviors back to the baseline level. And so that's a possibility that could occur that would limit your ability to implement a reversal design in some settings with some folks. And finally, reversal designs are generally only effective with reversible behavior. So for example, you couldn't use a reversible design to teach bike riding because once a person learns how to ride a bike, they generally know how to ride a bike from now on. Once an individual knows how to feed themselves, they generally know how to feed themselves for the rest of their lives. However, there is one caveat to that, and that's if these non-reversible behaviors are limited due to motivation. So for example, generally once people learn to conduct a simple math addition problem, they know how to do so from then on. But a student may not be motivated to complete the math operation problems that are required of him or her. And so then you might use a reversal design that involves differential reinforcement of completing math problems. And you could do that using a reversal design. So those are some things to think about when you are considering whether or not to use a reversal design to change your target behavior or the child's target behavior.